Hello and welcome, ladies and gentlemen, to a new edition of the Daily Debate. In tonight's show, we're going to be following up on the Egyptian national healthcare insurance system that was actually launched in 2019 in selected governorates. We're going to be following up on the healthcare insurance system in general and the initiative and those 5 governorates since 2019 up until now. But before we start doing that, let's check out some of the main stories making the news today. And we'll start off with President Abdel Fattah al-Sisi, who held talks with the visiting Mauritania's Minister of Cooperation and Foreign Affairs, Mohammed Salim Wild Marzouk, in Cairo on Tuesday. During the meeting, President al-Sisi expressed his willingness to activate bilateral cooperation mechanisms with Mauritania in various domains. The head of state further said Cairo is ready to provide assistance to Mauritania with the aim of developing and upgrading its cadres in different fields. Presidential spokesman Ahmed Fahmy said the minister delivered a written message to President al-Sisi from his Mauritanian counterpart, Mohammed Wild al-Ghazouani. The message expressed Mauritania's appreciation to Egypt's role on the Arab and African arenas and its keenness to boost bilateral ties. It revealed Mauritania's keenness to benefit from the Egyptian developmental experiment. The meeting witnessed the exchange of points of view between the two sides over regional issues as they both stressed the importance of supporting joint Arab action. Meanwhile, Foreign Minister Sameh Shoukry stressed Cairo's keenness on boosting cooperation with Mauritania in various fields. Speaking during a meeting with Mauritania's Ministers of Foreign Affairs and Cooperation, Shoukry said Cairo is looking forward to convening the Joint Higher Committee. The top diplomat stressed the importance of cooperation between the two sides in combating terrorism. He noted that Egypt is providing technical support to Mauritania in various fields, including education, health and industry. For his part, Minister Wild Marzouk hailed ties between the two sides and a keenness to boost cooperation in various fields. The talks highlighted the importance of the bilateral ties, trade and investment cooperation, and a number of regional files of mutual concern. President Abdel Fattah al-Sisi also presided over the first meeting of the Supreme Investment Council after being restructured on Tuesday. During the meeting, President al-Sisi affirmed the state's keenness to take the necessary decisive measures to achieve a real breakthrough in encouraging, attracting and promoting investment at the local and international levels. The head of state stressed on the significance of eliminating bureaucratic obstacles and overcoming various challenges facing increasing private sector investments. This comes with the aim of building a diversified, productive base and achieving a comprehensive economic development. President al-Sisi highlighted the effect of positive steps and measures taken in this regard, with the aim of doubling the private sector's investments and facilitating investments climate. President al-Sisi directed to vitalize the role of the private sector and to double incentives and facilities to create an attractive climate for investments in various sectors. During the meeting, Prime Minister Mustafa Madbouli made a presentation that included the most important indicators and facts related to investment in Egypt, measures that have been taken, and ways of improving the investment environment. Meanwhile, the Supreme Investment Council approved 22 important decisions in various economic sectors to achieve a quantum leap in reducing the cost of establishing companies, reducing the restrictions imposed in cooperation, as well as facilitating land ownership and expanding issuance of golden license, among others. In this regard, President al-Sisi assigned the government to prepare the ratified decisions to be implemented quickly, as well as unifying a pricing strategy according to a set timetable. These were a couple of the stories making the news today, but now focusing on the healthcare sector. Now, Egypt is underway in trying to implement the national healthcare insurance system all over the country, something that should be taking 10 years to implement. Let's check out this report and we'll be right back.
The National Comprehensive Health Insurance Project provides healthcare for all Egyptians. The Universal Health Insurance Project was announced by President Fattah al-Sisi in 2019 as the launch of the first phase of the implemented in the governorates of Port Said, Ismailia, Suez, South Sinai, North Sinai, with the preliminary steps and procedures at specific times and timetables. The Universal Health Insurance Project aims at eliminating waiting lists for patients that need critical surgeries and medical interventions within a 6-month period, launching the Model Hospitals Development Project with a total of 47 hospitals in all governorates of Egypt, which is affiliated with the Ministry of Health and university hospitals, providing strategic stocks of infant formula and vaccines, scanning and comprehensive treatment of hepatitis C virus with a total of 45 million Egyptian citizens in partnership with major drug companies within 2 years, completing the preparation and mechanization of Port Said Governorate in terms of construction and equipment, preparation of manpower, inventory and registration of beneficiaries within a year, provided that the implementation will start successively in the remaining governorates of the first stage, Suez, Ismailia, North and South Sinai. The project also aims to reform the entire healthcare system, not just the health insurance sector, in addition to providing healthcare services for all in order to achieve social solidarity between members of the society, besides providing a good health service that covers all diseases. To also contribute to amend the structure of household spending that directs 60% of its income to be spent directly on health, knowing that the law will be applied in 6 stages that cover all governorates of the Republic and work to reduce poverty and disease rates. The project focuses on providing full medical protection for the entire family, and those who can afford the fees shall pay for this service. However, the public budget will cover the costs of the families that cannot afford paying.
Welcome back, ladies and gentlemen, and we're joined here tonight in the studio by Dr. Anan, the lecturer on health policy and health economics at Ain Shams University. Dr. Anan, good evening and thank you very much for joining us.
Good evening, and always delighted to be guest for the
debate. Pleasure, sir.
Thank you.
Dr. Anan, first of all, the Egyptian National Healthcare Insurance System was a project really a dream come true for all Egyptians, and it was established and launched in 2019 in selected governorates. Now, since 2019, now in 2023, how far do you feel the development of the insurance system has been so far?
Okay, perfect. And to continue what we were usually talking about since the launch, currently we do have a lot of updates. So we launched Universal Health Insurance Organization, which will or should cover all Egyptians by 2030 or 2032. And currently the good updates is that we do have an Egyptian Health Authority, what we call an EHA, which is responsible for the establishment and the preparation of all governorates to be involved in the Universal Health Insurance. So currently we actually, Egypt launched 5 governorates, and the plan is to have another 5 soon, and then it will be actually a governorate after governorate till we reach all governorates, inshallah, by 2030. The good thing is the split between who's actually preparing the service, like what we were just talking about, the organization of EHA, and that the Universal Health Insurance Authority, which is the UHIE, a lot of abbreviations, sorry, which will be responsible for the insurance itself. So the good thing is the Egyptians were all the time actually in what I can call a dilemma whether he's insured in the old insurance system or what we call the on-state fund, نفقة الدولة. And so sometimes the people are all the time asking about the logistics. It's long logistic. We cannot understand the system. So the universal health insurance is a very simple thing. Currently, the governorates involved, they will be directed automatically to a call center, which is a good update. They can just take an appointment, go to the healthcare service providing unit, whether it's a hospital or a primary care, and they can receive the service automatically. So we currently do have the authority, which is responsible for collecting all the premiums. So all the governorates involved, they are actually now, they are not paying any tax for the old system, they are paying premiums for the new system. In Cairo, which will be the last governorate, for example, just to give an example, we will drop all public insurance system and will be paying as a household a premium to the Universal Health Insurance Authority, which will then make the Egyptian Health Authority, the EHA, provide us the service for free, completely for free. And the good thing, again, and it's a good update, that the private sector is actually involved. So all the famous names that we know, without mentioning any names from the private hospitals, will be involved as well in the EHA system. So we can go to a private hospital, we can go to a governmental hospital and get our medical insurance or the medical service that we are actually seeking. And the payment will be for only who's actually afford. The underprivileged and who cannot afford, the Ministry of Finance or the government itself will be paying on their behalf. So that's a recent update. And another update is, above all that, this will not going to be achieved without a good digitization and digitalization for the systems as well.
Yes. Well, let's take it one point at a time. First off, 5 governorates have been selected since 2019, and you're saying that 5 new governorates will be selected soon. Now, what has been the criteria for picking the first 5 and the second 5? Is it the number of, is it the population? Is it about the already existing health facilities that would be just easier to develop? Or what is exactly the criteria for picking the first 5 and the second 5?
That's a very good question. So it was put as 5 phases, and for each phase you got certain governorates. The first governorate, for example, it was based on Port-Said. It was based that we do have a good infrastructure and a limited population, a closed city, that we can test the efficiency and the effectiveness of the insurance system, and then to pick, or actually to select what's the gaps that we can find in the pilot phase, and then try to avoid or try to develop if it's a good thing in the next governorate. So phase 1, mainly small cities, small governorates. And in the next phase, we will do have a large population governorate as well, plus medium to small governorates, population from population perspective. And then the phase 4 and 5, this will be the large populous governorates. We are talking about Delta governorates, we are talking about Cairo and Giza, which is actually very diverse. We are talking about Cairo and Giza, population above 20 million. It's a country on its own.
Yes.
So it will be in the last phase. So selection is based on having infrastructure, which governorate is ready now, which governorate that we do have a good database that we can depend on in terms of, for example, having an equipped call center that we can receive the calls from citizens and then direct them to the EHA. And as well, it depends on the accreditation of the hospitals, because any hospital to be involved in the new system, it must be accredited from the GAHAR. GAHAR, it's a new entity formed in 2019 as well to accredit hospitals which will be involved, and pharmacists as well, pharmacists to be involved in the new system. Once GAHAR is saying that I approved all or the necessary hospitals in a governorate, the governorate will be ready now. So with these 5 phases, GAHAR will start first, then they will deliver the hospitals, the ready hospitals, to the Egyptian Health Authority, which will be responsible for hospitals. And then the Universal Health Insurance Authority will start the governorate or start activating the governorate for the insurance.
Well, what about the first 5 governorates, which started off with Port-Said, basically? How would you evaluate the performance of the actual implementation? What were the biggest obstacles? What were the biggest hurdles and challenges that we needed to overcome to establish a smooth insurance system?
Yeah, sure. It's an ongoing development process. So, for example, you do have a rush hours for the call center. You identify the rush hours, so you need to have more call center agents. For example, you do have a high flow in certain hospitals and limited flow in another hospitals. You do have, for example, diagnostics that can be shared between two hospitals. So all the time you are learning about the infrastructure distribution. We don't need an equipped hospital with all diagnostics in every hospital,
Yes.
but at least we need a diagnostic central place who can actually serve 3 or 4 hospitals. So every time you are doing any service, you are learning, you are building a new database. So for example, just to give the people an idea, you need to list down all the medical services with new codes so it can be identified in a new system, for example. So whenever any medication, any surgery, any intervention that a citizen is seeking from the old insurance, it must be recoded in the new system,
Yes.
which is not an easy task. We are talking about a digital document which can be above 1,000 pages. And then you are adding to it because every day you got new medications, every time you have new interventions in healthcare or a new diagnostic that you need to add. And we are talking about scarce resources, of course, in healthcare. That's a global dilemma, that you need to make sure that you are efficient enough and all your resources actually well utilized in the healthcare services.
Yes. Well, you've mentioned a few times the importance of the data collection and the digitalization of all the data that are present and they are currently being updated. Now, it has been a challenge for the quality of the data collecting process. What can be done to actually speed it up and make sure it's not just transforming the data from one form to another, but the accuracy of it, the role of the civil registration and vital statistics system, for instance?
Yeah, the very first basic thing is to separate the digitization and digitalization from the health insurance. And that's why in 2019, the government established eHealth. So eHealth, it's an authority which is completely independent, and they are responsible for the complete digitization of the process. And for digitization, we are talking about just moving from analog to digital.
Yes.
So no paper anymore, it's a paperless system. And the eHealth is actually equipping all hospitals and all the system with computers, with facilities that we don't need to use paper anymore. And then they ensure that we do have a digitalization system. It's something like health information system, what we call an HIS, where you do have an spontaneous analytics from data collection point, from the outlet itself, till a central hub where the data is collected. And we are talking about big data, we're talking about artificial intelligence, because if we are talking about any data above 1 million data point, 1 million citizen, we cannot just analyze it on computers. We need supercomputers. And hence, eHealth is actually established, and it's part of eFinance, the digital arm of the government.
Yes.
So they can actually analyze it, just put it in dashboard and make the analytics and give it to decision makers to make, and mainly the main objective is better decisions in terms of whether we are actually overspending in a hospital, overspending in a governorate, underspending for a disease area, for example. So they do have what we call a strategic prioritization plan. We can actually relocate money. It was a big dilemma in the past because you do have budget and you are not sure that you are actually relocating the budget for diseases or per diseases in an efficient way. For example, should we actually invest more in cancer, or we should invest more in dialysis and nephrology? So we need a systemic and systematic way of actually doing that. And in terms of doing that, the best way is analysis, data analysis, and having good research minds. And I'm actually optimistic having eHealth because they are all computer science, data analytics researchers who are actually isolated from the organizations and authorities of health. So we are actually focusing only on the analytics and giving dashboards and giving reports to the governorate after governorate.
Well, then it would be the responsibility of actual people who are experts within the data analysis, or would it also depend on artificial intelligence, for instance, and information communication technology, really trying to make the decisions or help you make the decisions for financing or allocating certain resources to certain sectors or certain specializations?
Yeah, currently we depend a little bit, not
Entirely on
entirely
AI.
on AI. However, AI will give us insight, especially if we are talking big data, because if we are talking small data like before, we are just putting any hypothesis and we are trying to analyze it and take a decision based on just a certain population, based on certain disease. But for AI, it's easier because we can actually inject 2 million or 3 million data points or data from citizens, and the AI will just give you patterns, will just tell you, okay, you do need to have decisions here and there and so on. It will give you some gaps. So it helps in analysis, and then it's very important, especially in health, that we revisit the recommendation of AI. We return back, okay, that's your recommendation. Let's actually make a root cause analysis to make sure that AI is actually matching reality. Till now, the AI is not that efficient in exactly making a good recommendation, especially that you need to feed in all the Egyptian variables and parameters, which is completely different than the standard one. And in diagnostics, for example, AI actually is a major support. So, for example, you can give the AI all the input in diagnostic, and they recommend the next steps. They recommend even currently the treatment plan, so they can shorten the process, or what we call the turnaround time of the patient journey. If the patient journey it takes like 1 month to be diagnosed, it can be 2 weeks if you are using AI, for example.
Dr. Anan, you're knowledgeable about these things because you're involved in the industry, but a random Egyptian citizen is not knowledgeable actually about a health insurance system. Is he covered by a health insurance system? Is he covered by state funding, the bureaucratic procedures that a citizen would have to go through to be funded by the state? Or should he be totally independently financed? Are there sort of awareness campaigns? Are there plans to educate or really plant the health insurance system culture within the Egyptian citizen?
Yeah, and in terms of health, definitely what we would like to achieve is reaching people.
Yes.
You can have a good access plan, whether you are putting infrastructure, you are putting hospitals, you are putting a good system in terms of digitalization. If you cannot reach people, it will be useless. So I totally agree. Awareness campaigns are actually essential. And if we're talking about the new system, for the involved governorates already enrolled in the system, they are all aware, because once you launch it in a campaign and you tell them that your old insurance is actually obsolete. So you need to actually revisit your paperwork and you'll be enrolled in the new system. So in terms of the governorates enrolled already, they do have a good awareness. In terms of the governorate that will be enrolled, this is a big question mark. Because we need from media, what we are doing currently, from even PR perspective, that every citizen needs to know that he's actually insured. Whether old system or new system, he's insured. Any Egyptian citizen got the right to have his actual health care for free. So we do have 2 types of insurance for the cities or the governorates which is still not enrolled in the new system. It's either health insurance organization, what we call it Ta'min al-Sahi, or on a state fund, what we call Al-Alaj ala Nafaqat al-Dawla. We have 2 systems, and any citizen can actually be enrolled. Either is eligible for HIO, for example, any governmental employee, and we do have a certain criteria. Otherwise, he will be actually eligible for on a state fund. The problem is in the logistics. Sometimes we are not aware about the logistics, how to actually issue an on-state fund treatment, for example. We need more awareness about it. However, just from here, it's a good opportunity to tell them that they can go just to websites. Currently, we are in a digital health era. On the websites of the Ministry of Health, they can understand exactly whether they are eligible for the on-state fund or eligible for the health insurance organization. They do have the templates on the website. They can just fill the template, and they can actually, in some services for state fund, they can apply it online, and they can receive it online as well, and they can just head to the on state fund, what we call the trust, which is hospitals, and start their treatment plan.
Yes. Well, Everybody understands that the health sector is a sector that definitely needs a lot of financing, and trying to implement a healthcare insurance system all over the country of over 100 million citizens, it will need a lot of financing. Now, the government has increased the sort of amount of money from its yearly budget from 1.5% to 3%. There's also the WHO, the World Bank, the French Development Agency, the Japan International Cooperation Agency as well. They're all trying, they're all financing about $1 billion maybe as well for the healthcare insurance system. Now, is this enough financing to really work on achieving a complete implementation all over the country for the health insurance system in 10 years' time, or do we need more? Can we achieve it in less time?
So what we can see from financial reports for the governorates already enrolled, that health financing is better in the new structure than the old one. The old one, it was actually an allocated budget from Ministry of Finance to the Ministry of Health and all the health units. For the new system, it will not going to be like this. Universal Health Insurance Organization, the authority, they do have a separate fund which is exactly like private insurance. So all citizens will be paying a premium like the private insurance to the Universal Health Insurance Authority, and then they do have a fund, and then they start financing. And from the financial reports, we can see a surplus. We can see that they do have enough budget for the governorates and to enroll new governorates, which is higher, significantly higher than the budget actually allocated currently for the governorates still not enrolled, which is make us optimistic that, and worldwide this is actually the trend, that if you'd like to finance health, you need to finance it based on the economy. Our GDP is rising, you are taking premiums, we are financing healthcare. GDP is declining, the premiums will be less, healthcare services will be less. So we connect the health services with our work, with our economy, and our effort as citizens, which is fair enough for all countries to actually perform well in the economy in terms of having more health services served to them.
Well, if we are working on the digitization, the infrastructure, allocating certain funding all over the different governorates, trying to give a fair and premium service for all governorates equally. Now, what about the personnel? Do we have enough personnel who would offer premium medical and healthcare services all over the 27 Egyptian governorates to cover over 100 million?
Yes, if we are talking about the capacity building of human resources in terms of healthcare professionals and health administrators and admin, actually for the previous 3 years, we are actually witnessing a huge capacity building, whether for the new health insurance organizations or even in general for the old one. There is actually a dedicated place which was not actually located before for training. We do have the National Training Institute, which is a governmental institute mainly and dedicated only for medical education for healthcare professionals. We do have a minister assistant only for training. So his sole main job is actually only training on a daily basis. So we've witnessed Harvard Medical School giving trainings for doctors for 2 years. We've witnessed all the big universities, medical hubs and medical schools invited to Egypt to give courses. I can say, for example, even as an instructor there, I've witnessed an education for more than 20,000 healthcare professionals in 2 years. So we are talking about massive hands-on training, capacity building, and not theoretical, because most of the trainings are done at their workplace. Most of that is actually workshops, whether it's a new intervention, whether it's a new logistic, or even for pharmacoeconomics, health economics, even for health policy, they are giving them a lot of trainings on health policy and health economics, which is a new trend, which I'm happy about.
Yes, obviously.
And on digitalization, because they will be dealing with codes. They're not going to be dealing with normal prescriptions or normal diagnosis like before. For a physician, a disease will be just a code. So they need to understand that they are not making a data entry for diseases anymore, for coding only, for example, and so on.
Well, ladies and gentlemen, the Minister of Finance has actually vowed that the National Universal Health Insurance System will be implemented in Egypt fully in 10 years' time. Let's check out this report and we'll be right back.
Minister of Finance Mohammed Mai said that the Universal Health Insurance System would be implemented in all Egyptian governorates within 10 years upon presidential mandate to compress its 15-year planned timetable. Maid added that providing comprehensive and integrated health care for all members of the Egyptian family is a target that cannot be postponed. This comes despite all global economic crises resulting from coronavirus pandemic and Russia-Ukraine war that have forced the whole world to rearrange spending priorities. The Universal Health Insurance System will be implemented in the rest of its first phases governorates, Suez, Aswan and South Sinai before the end of the current fiscal year 2022-2023 after the experience has succeeded in Luxor and Port Said and expanded to Ismailia. The six-phase healthcare scheme started experimentally in Port Said in early 2018 and later expanded to Luxor and Ismailia, with the lowest income citizens being given priority in the program's schedule. The capital, Cairo, was relegated to the final phase. Over 5 million Egyptian citizens have been registered in the country's healthcare system in the governorates of the first phase. Minister of Health and Population Khaled Abdul Ghaffar said that nearly 15.3 million people would be added to the country's health insurance system in 2023, including farmers, seasonal workers, taxi drivers, fishermen, and construction workers, as well as transport and shipping workers. The beneficiaries of the system had the right to choose where they can receive medical service from the approved authorities under the umbrella of the new insurance system. The Universal Health Insurance System covers more than 3,000 diverse health services ranging from surgical intrusions, medical analysis, radiology scans, tumor treatments, organ transplantations, as well as prosthetic devices in accordance with the latest developments in the medical fields. Moreover, Might assured that for the needy families, the state's public treasury would bear the financial burden of their sickness along with the risks and psychological consequences. CEO of the Universal Health Insurance Authority, Hossein Sadiq, said that the Universal Health Insurance System is keen to provide a quick and instant response to the people's complaints on its unified complaints platform. The health insurance system will be supported by state-of-the-art automation technologies as part of the Digital Egypt Strategy, a broader national plan targeting digitization of all government services countrywide.
Welcome back, ladies and gentlemen, continuing our discussion with Dr. Anan. Now, Doctor, you've mentioned the importance of the private sector and its involvement in the Egyptian national health insurance system. Now, the private sector, the private hospitals, the independent private doctors, they definitely make more profits and more money than working publicly. How can we convince or get the private sector to be involved with the same sort of professionalism, with the highest standards for medical healthcare services, to be involved and provided within the healthcare insurance system?
So the public-private partnership, or what we call it Triple P, is very important and essential worldwide. Any countries that would like to launch a universal insurance system, they need the private sector. The main dilemma is how can you actually give them their money, because they are costing the medical service higher than the governmental sector.
Yes.
So they need to compromise a little bit versus volume. So it's a price volume agreement. So for example, they are insuring higher flow, and we are talking about an insurance system, the new law, that will cancel most of the private insurance premiums. So whenever anyone is actually currently working in a multinational, working in a company, and having a private insurance and going to a private hospital, most probably, when the UHIA will be applied, universal coverage, the company will be canceling their private insurance, and they will only have the universal health insurance. So all of us as Egyptians, we are forced, or actually there is no opt-out from the system. We will be going to private or public hospitals. The private hospital, they need to maintain flow.
Yes.
If they are actually out of the system, they are not going to have a flow of patients. If they are maintaining same prices, they are not going to be able to maintain except for a very small segment of people. Because, you know, in private hospitals, they rely more than 50% of their business on private insurance cards. They cannot actually sustain operations and everything without the private insurance. So what I am expecting is private companies or private hospitals will be providing the service with less costs versus a volume that they will agree with the public sector. So for example, a big private hospital will make a deal that they will be providing all the services, either that the patient can pay extra inside the private hospital to have an upgraded service, or he will be provided service as same price of the governmental hospital, but in a separate entity or in a separate wards. However, they need to be working with the public sector. They will have triple or even 4 or 5 times the flow they are actually taking from the private insurance cards only. So we are expecting this integration soon, inshallah.
Well, Dr. Anan, when we talk about the healthcare insurance system and we talk about the infrastructure, the medical infrastructure and all the government rates, a big part of Egypt is the countryside and the rural areas who are under the Decent Life Initiative already, but a lot of these places don't have, they don't have or enjoy really up-to-date clinics or up-to-date hospitals. So we're talking about basic infrastructure as well. Will these constitute a bigger sort of obstacle to actually, it's basically you're practically starting from scratch in a lot of these places. So is 10 years time a realistic sort of timeline or a timetable or a schedule to have the insurance system implemented all over?
10 years is actually a realistic timetable, and for the countryside, I agree, it's a big challenging actually angle for this project. However, you do have all the facilities. For example, any village, you will find healthcare units, but it's not operating as you would like it to be operated. So you need to increase the quality standards. You need to make a capacity building for them. And for all villages, rural sites, there is actually a limited tertiary care. Tertiary care, we are talking about specialized big hospitals providing specialized surgeries, for example. So we do have actually, yes, we do have shortage in villages, we do have shortage in rural areas. However, you can actually make a good referral system. If you look at most of the Gulf countries or even in Europe, they don't put tertiary hospitals or big hospitals in rural areas, but they make sure that all primary care units, the small units, are actually located and distributed all over the rural areas. We do have good operating primary care units in every village that they can actually diagnose, refer, and you can rely on telemedicine. It's actually waste of time and resources to refer patients from a village to a city, from a city to a city, what we are actually witnessing in the old system. Currently, and hence telemedicine is all over the world, is spreading massively, and even in Egypt, they started with 35 devices or something, so that in the primary care unit, they can refer digitally over Zoom. They make just a Zoom call with the tertiary hospital and get the diagnosis and everything inside the primary care. It will be efficient, and if you can rely on that, 10 years will be very realistic. Digital health is actually cheaper in terms of long-term investment. Maybe you are buying a very expensive currently on the spot devices, but it's very cost-effective on the long term. You are saving a lot of days for citizens traveling or commuting from a city to a city just to get their treatment, for example. The satellite unit, it's a WHO invention, which is running in a lot of countries for a decade now, where you have in the rural areas a satellite units moving like caravans or cars, moving with the treatment And with the diagnostics from a city or a village to a village, they can provide diagnosis, they can provide the monthly treatment instead of the people commuting to another city. So these all are actually cheap, cost-effective options that you can, instead of just moving for the standard way of having a hospital in each village, having tertiary care, having all the specialties in one hospital in a village. No country is doing that now. You do have a shortage in physicians. You do have a shortage in terms of equipments worldwide. So either countries depend on digital. We are talking about like India, for example, 1.5 billion. They cannot rely on tertiary care hospitals in all the countrysides. So they depend on telemedicine and they depend on satellite units.
And is there a possibility, for instance, if a patient can't wait for a mobile sort of treatment care unit moving around, and they actually need to commute from one governorate to another, is there some sort of an agreement with the Ministry of Transportation, with the Ministry of Health and Population, that would include covering the fees of commuting the patients from one place to another?
Yeah, commuting is actually covered by law, by the way. So even for cancer patients, they are reimbursing their transportation, hepatitis patients as well. And we do have two things. If it's an emergency, the primary care can provide emergency and just commute them in an ER. If it's not an emergency, they can just, instead of moving, so I will tell you an example. People in Wahat, they used to go to Marsa Matruh, and then from Marsa Matruh to Alexandria, just to get their treatment. So currently, they can just get it from the satellite or the telemedicine because it's not an emergency, and it can be scheduled month after month.
Ladies and gentlemen, definitely a health insurance system is quite a revolutionary sort of medical step that is being taken here for the sake of the Egyptians' health. Unfortunately, that's all the time we have for this edition of the Daily Debate. But before we go, I'd like to thank my very distinguished guest, Dr. Islam Anan, the lecturer on health policy and health economics at Ain Shams University. Dr. Anan, it was a pleasure having you with us.
Always a pleasure.
Thank you very much, sir. Ladies and gentlemen, please stay tuned for more coming up on Al International. I'm Henny Saif. Thank you for joining us.